Welcome back. A recent Stanford study has found that more high school students are turning to disposable vapes rather than cartridge-based vapes at an increasing rate. This comes despite attempts from federal regulators to cut down on vaping among teens and young adults. For more on what's driving the trend among teen vaping, joining us now is Dr. Bonnie Halpern-Felsher. She is a pediatrics psychologist at Stanford Medicine and the senior author of this study. Thanks so much for joining us, Bonnie.
Good morning. Thank you for having me.
So your research found a big rise in the use of disposable vapes. So what makes those different from the pod-based vapes that we hear about like Juul?
Sure. So the pod-based vapes like Juul, they are a small device that looks like a USB that then also has a separate pod or cartridge. And within that is containing the flavors, the nicotine, and all the other constituents and chemicals within it. That became very, very popular with teens, starting with Juul around 2015, 2016 for several years. Then around 2018, we saw a switch to these disposables. They're very similar. They just are self-contained within the cartridge, self-contained rather than have a separate part that's the pod.
So the FDA has tried to restrict the use of these devices. You know, they've banned certain flavors. Why do you think that's not enough?
Right. Well, we know that in January 2020, the FDA basically did prioritized enforcement against cartridge or pod-based products, and then all flavors except for menthol and tobacco. Well, what happened is they didn't prioritize enforcement against all electronic cigarettes or vaping devices. And so it's not surprising that our study showed that in May of 2020, teens then were using these new disposables that are pretty similar, and that they were still continuing to find and use all flavors, including mango, fruit, mint, and menthol, and particularly mint and menthol. So basically what we're seeing is that when one product is regulated, then teenagers and young adults seem to be just switching over to another product.
Do you think that's because teens think it's not as bad as something like Juul? Like why would they switch over to that and not think of the effects?
Right. Well, I mean, to be honest, the health effects and the mechanisms of these devices are pretty similar across all the vaping devices. We think it may be a supply demand that they're not able to find Juul as much or other pod-based products because of the fact that a lot of the shelf space and a lot of the Juul or pod-based products had to either come off the market or have limited flavors because of the prioritization. So we think that it's more that there's availability, there's more access in these disposable products, but they also became the cool new thing. Teens will go, we talk about whack-a-mole, they'll go from one product to another. And if we simply only regulate or enforce policies against one product and the other product is more available, it makes sense that teens are going to switch over. So we really need to be doing policies enforcing regulation around all products and all different devices for vaping and not just one at a time.
I see. I think there is this sense of, pride that a lot of teens are not smoking cigarettes. So it seemed like that worked. But obviously there's more to be done.
Absolutely. I mean, we've done a really good job in tobacco control and policies to reduce smoking overall, and particularly teen smoking. I mean, we're well below 10% across the US and really below, more like around 5-6% of teens smoking cigarettes in California. That's great news. But you're absolutely right. We've sort of renormalized and it's become more socially normative and accepted to use vaping devices. And so we really have to do the same policies, the same changes of social norms with vaping products that we did with cigarettes. We need to really explain that these are harmful to you, that they have a lot of harm around the propylene glycol, the glycerin, the flavors, that these are not harmless. And we have to do everything possible, especially now during COVID, to protect our teens' lungs.
So we know that New Zealand, they announced plans to eventually ban all sales based on age. Do you think the US should be doing something like that?
Well, it's really hard to say whether they should ban all products or whether there is a place. We really need more studies to say whether there's a place for maybe tobacco flavored e-cigarettes But what we do need are policies that get rid of all the flavors. There's no reason to have e-cigarettes in flavors that, particularly those that are attractive to young people. There's no reason to be having so much nicotine. These vaping devices have between 1 and 2 packs of cigarettes worth of nicotine. There's no reason to have them small, blingy, where they're very little and very easy to hide. In our research, a lot of teens say that they use these products because they're easy to hide. They smell good, they taste good, they have a huge amount of nicotine, they get the buzz. So we need to really regulate and put policies in place so that way these products are not available, not accessible, and not attractive to young people.
Right. All right. Well, thank you so much, Bonnie, for joining us, and we will see what policies get put in place because of that. Thank you so much.
Thank you very much.